Next, we have our guest faculty, Dr. Manju M. She is a consultant dermatologist and cosmetologist at Sunrise Hospital, Kochi. The talk is on all about dark circles.
Good morning, everyone. I thank Dr. Shebin and the Drishti organizers for giving me this opportunity. The topic assigned to me is dark circles or periorbital melanosis. So this is the disclaimer. And periorbital melanosis, also known as dark circles, periorbital hyperpigmentation, periocular melanosis, and idiopathic cutaneous hyperchromia of the orbital region. This is a very short presentation. In this presentation, I'll be mainly discussing the different types of periorbital melanosis and how to differentiate and what are the treatment options available. It can affect both sexes, young and old. Sometimes it can be familiar, usually bilateral with one eye involved more than the other. It can affect the upper eyelid, lower eyelid, or the both. Classification, mainly 4 major types, but there are other types also. The main types are constitutional, vascular, structural, and post-inflammatory. This is the constitutional type. In constitutional, the pigmentation is confined to the orbital margin, present as a curved band of brownish to black hyperpigmentation of the lower eyelid skin along the shape of the orbital rim. It can also affect the upper eyelids also. Then vascular, when there is prominence of the vessels in the periorbital area, this is a cause of vascular type of dark circles. Then structural, it is mainly due to the shadowing effect of the tear trough or the fat herniation. With aging, there is laxity of the lid and cheek junction, and there is herniation of the fat pads. Post-inflammatory, when there is pigmentation secondary to atopic dermatitis, allergic contact dermatitis, or fixed drug eruption, we call it post-inflammatory pigmentation. In the initial stages, that will present as erythema, and later when it heals, it can leave the pigmentation and it can present as dark circles. Coming to the other causes of periorbital melanosis, it can be an extension of pigment demarcation line. Pigment demarcation line means there's a clear line of demarcation between the hyperpigmented area and the normal skin. When there are different types of pigment demarcation lines in our skin. When it involves the periorbital area, it can be a V-shaped pattern or it can be a W-shaped pattern. In the first picture, you can see the V-shaped pigmentation in the periorbital area, and in the second picture, you can see the W-shaped pattern. This patient has the W-shaped pattern of pigment demarcation line with a tear trough. Tear trough is the medial 1/3 of the periocular sulcus. When there is presence of dermal melanocytes in the periorbital area, it can be a cause for dark circles. This is a picture of nevus of aorta. In this picture, the patient has bluish black pigmentation involving the periorbital area along with involvement of the sclera. Then lichen planus pigmentosus is a type of lichen planus present as bluish black pigmentation. Any part of the body can be affected. When it occurs over the face, it can also present as pigmentation around the periorbital area. Next, melasma. When the melasma present in the periorbital area, it's also another differential diagnosis for dark circles. Then periorbital acanthosis nigricans. Acanthosis nigricans present as hyperpigmented velvety plaques over the flexures and the neck, and sometimes it can involve the face. When it involves the face, there will be a velvety texture over the eyelids also. Certain drugs like hydroquinone, estrogen, NSAID, bimetoprost, and latanoprost can induce the periorbital pigmentation. Systemic diseases like thyroid, Addison's disease, anemia, lifestyle changes like smoking, alcohol, lack of sleep, and stress can also induce the dark circles. Another most important thing is photo damage. When there is excessive UV exposure, that will lead to the oxidative stress, and there will be pigmentation around the eyes and also laxity around the eyes. Then how to differentiate when a patient steps in with a periorbital melanosis is a very simple technique. Just manual stretching of the lower eyelid, we can differentiate whether it's a true pigmentation or the shadowing effect. When we stretch, if the pigmentation is remaining like that, it's a true pigmentation. When we stretch, the pigmentation is disappearing, it's a shadowing effect due to the tear trough or the other structural anomalies. When there is increased violaceous discoloration when we stretches, can be due to the vascular prominence. In this video, when we stretches the lower eyelid, the pigmentation is remaining. So it's a type of true pigmentation. And by using Wood's lamp, we can differentiate whether it's an epidermal pigmentation or a dermal pigmentation. In epidermal pigmentation, the pigmentation will be more evident with Wood's lamp, and in dermal pigmentation, the pigmentation will be less evident. Coming to the treatment, the dark circles are a little bit challenging to treat. It lacks a straightforward and a repeatable therapeutic option. What we usually practice is a multimodality treatment that will be more efficacious and long lasting. And the most important thing is we have to find out the cause. In the treatment part, the sun protection is very, very important. Sunscreen, even if you are sitting indoors, we have to apply the sunscreen. Before 9 o'clock, we have to apply the 9 to 4, the UV light is causing more damage. So before 9 o'clock, we have to apply the sunscreen, and it's better to reapply the sunscreen every 3 to 4 hourly. And we can also use the sunglasses. These are some of the topical treatment options, and we can the topical agents containing alpha-arbutin, kojic acid, azelaic acid or retinoic acid we can use. When the topical treatment fails, we can plan chemical peeling. We can use the trichloroacetic acid peel, glycolic acid peel, lactic acid peels in the periorbital area. Usually we need repeat sessions. Next treatment option is lasers. When the treatment fails in terms of the topical treatment and the chemical peeling, we can try the periorbital laser toning. As a part of periorbital rejuvenation, we can also try microneedling, PRP injections or CO2 laser treatment. When there is skin laxity and tear trough, we have to inject the hyaluronic acid fillers or the autologous fat transplant. In case of periorbital fat herniation, we have to do blepharoplasty. So coming to the approach, when a patient comes with periorbital melanosis, what I usually practice is first we will differentiate whether it's a true pigmentation or it's a structural. And if it is a true pigmentation, first we'll give the topical treatment. We can give the topical treatment for 1 or 1.5 months. If there is no improvement, we can advise regarding chemical peeling. Chemical peeling, usually we do 2 to 3 sessions of peels in 2 weekly interval. If there is no response and if the patient is willing, we can go for laser toning treatment. And if it's a vascular pigmentation, lasers will work. And the structural, we have to do fillers, fat transplant or blepharoplasty. Some of the procedure videos. This is the chemical peeling. We can apply the peeling solution after cleansing the area and wait for some minute, and then we'll neutralize. Next, laser toning. Before doing laser toning in the periorbital area, we have to protect the eyes with the metal eye shield. And before placing the metal eye shield, we will usually anesthetize the area with using the topical anesthetic solutions. And then we'll place the metal eye shield. After that, we can do the laser toning. It's a painless procedure, very simple. This is the micro needling. we use the derma pen. We are creating micro injuries around the eyes, and the micro needling can also be used along with PRP as a part of rejuvenation. So the take-home message is, the main thing is we have to educate the patient. It's a chronic condition. Strict UV protection is needed, and the patient has to stick to the prescribed treatment. It takes time to see the result, and the continuation of treatment is very important when you see the result, and the multimodality treatment works better. Thank you. Thank you so much.